Picture a man who did everything right. He walked 3 miles most mornings. He ate more vegetables than his own doctor did. His cholesterol numbers came back perfect on paper. And 6 weeks after his last checkup, he collapsed in his own kitchen with a heart attack that nearly killed him. If you think being healthy is the same thing as being protected, I need you to hear something today that most doctors do not say out loud. Sometimes the very habits that make you feel invincible are the ones hiding the real danger until it is too late to see it coming. By the end of this video, you will know the one number your doctor may never have mentioned to you, the number that matters more than your weight, more than your cholesterol, and more than how many miles you can run. Before we go further, if you want more of these honest conversations about the things nobody tells you until it is an emergency, take a moment and subscribe to this channel. It costs you nothing, and it means these videos reach someone else who might need to hear this exact warning before it becomes their emergency too. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50 who are trying to protect their health before something goes seriously wrong. I did not write this video to scare you. I wrote it because I have sat across from too many patients who looked healthy, felt healthy, and were told they were healthy, right up until the moment their heart told them the truth. Before we go deeper, I want to ask you something. Has there ever been a moment in your life, or in the life of someone you love, when everything seemed completely fine, right up until it suddenly was not? Type yes in the comments if that sounds familiar, because what I am about to explain may finally give you the reason why. And if you have ever left a checkup feeling reassured, only to wonder later whether that reassurance was actually telling you the full story, this video was made specifically for you. Here is where most people get confused. When we talk about a heart attack, what is actually happening is something called atherosclerosis. That is simply the medical word for fatty and calcified buildup inside the wall of your arteries, the blood vessels that carry oxygen to your heart. It builds silently for years, sometimes decades, long before any blood test or scale would ever catch it. I want you to hold on to that word for a moment, because in a few minutes, I am going to explain why a completely normal cholesterol test can exist in the very same body that is quietly building this kind of blockage. I promise I will come back to that. Right now, without getting up, I want you to place 2 fingers gently on the side of your neck, just below your jaw, and feel for your pulse. Count the beats for 10 seconds in your head. Whatever number you just felt, multiply it by 6 in your mind. That is roughly your resting heart rate. Hold on to that number, because later in this video, I am going to tell you exactly what range keeps your heart working efficiently, and what range means it is working much harder than it should be year after year without you ever feeling it. Let me explain why a man or woman can walk out of a yearly physical with a clean bill of health and still be at serious risk. Most standard checkups measure total cholesterol and something called LDL, or low-density lipoprotein, which most people know as the so-called bad cholesterol. Those numbers matter, but they only tell part of the story. Think of your arteries like a copper pipe running through the wall of a house. Rust and mineral buildup happens slowly from the inside, where nobody can see it. You could look at that pipe from the outside for 30 years, and it would look brand new right up until the day it fails. Your arteries work the same way. The plaque that eventually causes a heart attack builds on the inside wall, invisible from the outside, invisible to a scale, invisible to how many miles you can run. The real damage often starts with something called endothelial dysfunction. That is a long term for the inner lining of your blood vessels becoming irritated and inflamed, almost like a sidewalk that develops tiny hairline cracks. On the surface, that sidewalk still looks smooth and solid. But once water gets into those cracks and freezes, the whole slab can split apart in an instant. Inside your arteries, the equivalent of that freezing water is chronic inflammation, driven by things like high blood sugar, high blood pressure, poor sleep, and long-term stress. Fat and cholesterol collect inside those tiny cracks, and over years that buildup can grow into what we call plaque. Here's the part that surprises most of my patients. A heart attack does not usually happen because a blood vessel slowly narrows until it closes completely, like a straw getting pinched shut. Far more often it happens because one of those plaque deposits ruptures suddenly, the way a small crack in a dam can widen without warning until the entire wall gives way at once. When that plaque ruptures, your body rushes to the area and forms a blood clot to try to seal the damage. And that clot is what actually blocks the artery and cuts off blood flow to part of your heart muscle. That is a myocardial infarction, which is simply the medical term for a heart attack, muscle tissue dying because it has been cut off from oxygen. This is exactly why a normal cholesterol panel can miss the danger completely. Total cholesterol and standard LDL testing are like a fire alarm that only goes off once the entire kitchen is already filled with smoke. They can completely miss the pot that has been quietly smoking on the stove for years. Two people can have the exact same cholesterol number, and one of them can have soft, unstable plaque that is close to rupturing, while the other has none at all. The number on the page looks identical. The risk underneath it is not. So let me address the belief I hear from almost every patient in this age group. Many people believe that if their cholesterol numbers come back normal, their heart must be fine. That belief feels reasonable, and I understand exactly why people trust it. But it is not accurate, and I want to be direct with you about that. Normal cholesterol numbers measure one piece of a much larger picture. They do not measure inflammation. They do not measure how calcified your arteries already are. They do not measure the size and stability of the particles carrying that cholesterol through your bloodstream. Research consistently shows that a significant number of people who suffer a heart attack had cholesterol numbers that would be considered normal or even good on a standard lab report. The reality is that heart disease can be actively building in a body that every conventional test says is healthy. This is where two additional pieces of information become so valuable. The first is a coronary artery calcium score, a simple imaging test that looks directly at your arteries and measures actual calcified plaque, rather than guessing at risk from blood numbers alone. The second is inflammation testing, including a marker called C-reactive protein, which reflects how much active inflammation is running through your blood vessels right now. Together, these two pieces of information tell a story that a standard cholesterol panel simply cannot tell on its own. There is one more piece worth understanding because it explains why two people who look equally fit can carry very different levels of risk. LDL cholesterol is not one single thing. It travels through your blood in particles, and those particles come in different sizes. Larger, fluffier particles tend to move through your artery walls without doing much damage. Smaller, denser particles are more likely to wedge into that inflamed inner lining I described earlier and start the whole process of plaque formation. Two people can have an identical total LDL number, and one of them can be carrying mostly the larger, safer particles, while the other is carrying mostly the small, dense, dangerous kind. Standard testing very rarely tells you which version you have. There is a more specific blood marker called lipoprotein a that can reveal this genetic pattern, and I will mention exactly when to ask for it before this video ends. There is also a number called triglycerides, and the relationship between your triglycerides and your HDL, the so-called good cholesterol, often tells us more than either number alone. When triglycerides run high and HDL runs low at the same time, it is often a sign that your body is struggling to process sugar and processed carbohydrates efficiently, even before a formal diabetes diagnosis would ever appear. Think of it like a warehouse loading dock. When shipments arrive faster than workers can unload them, boxes start piling up in the hallway. A high triglyceride number paired with a low HDL number is often that pile-up happening quietly inside your bloodstream, long before anyone official notices the hallway is blocked. Family history plays a role here too, one that has nothing to do with how well you eat or how often you exercise. If a parent or a sibling had a heart attack or needed a stent before the age of 60, your own risk rises regardless of your current fitness level, and that history alone is a reason to ask for calcium score testing sooner rather than later. Several everyday factors quietly push your body toward the more dangerous pattern, even when your weight and your outward appearance look completely healthy. Chronically high blood sugar, even in the range that is called prediabetes rather than full diabetes, damages the inner lining of your arteries over time. Elevated blood pressure does something similar, putting constant mechanical strain on vessel walls that are already trying to heal from inflammation. When we talk about blood pressure specifically, the number many people were taught to accept, 140/90, is now considered too high by most cardiology guidelines. Current thinking generally targets readings closer to 120/80 for most adults, and consistently running above that, even by a small margin, adds measurable strain to the same vessel walls we have been discussing this entire video. Poor sleep, especially consistently getting less than 6 hours a night, has been shown in research to raise inflammation markers and blood pressure at the same time. And chronic, unmanaged stress keeps a hormone called cortisol elevated for long stretches, which contributes to higher blood sugar, higher blood pressure, and more inflammation all at once. None of these factors show up clearly on a bathroom scale. All of them can be quietly building the exact kind of plaque that eventually ruptures. This is exactly why I tell my patients that looking healthy and being protected from a heart attack are not always the same thing. You can be at a healthy weight, eat reasonably well, and still be carrying hidden inflammation, small dense LDL particles, and early calcified plaque that no scale and no mirror will ever reveal. The good news, and I promise there is real good news coming, is that every single one of these hidden risk factors can be measured, and most of them can be improved, often significantly, once you know they are there. Let me tell you about a patient I will call Richard, because his story is one I think about often. Richard was 63 years old, a retired high school math teacher from Columbus, Ohio. He was proud of how he had aged. He ran 3 miles 4 mornings a week, rain or shine. He had swapped fried food for grilled food years earlier. His last 2 annual physicals came back with cholesterol numbers his own doctor called excellent. Richard genuinely believed, and had every reason to believe, that his heart was one of the healthiest parts of his entire body. One Tuesday morning in October, Richard was raking leaves in his front yard, something he had done every fall for 30 years without a second thought. Partway through the pile, he felt a strange pressure settle across his chest, heavy and tight, almost like someone had set a sandbag on top of him. He assumed it was muscle strain from bending over the rake. He sat down on his porch steps to catch his breath. The pressure did not go away. It spread slowly into his left arm and up into his jaw. His wife found him pale and sweating 10 minutes later and called for help immediately. At the hospital, doctors found significant blockage in one of the major arteries feeding his heart. Blockage that had almost certainly been building for years, hidden underneath every one of those excellent cholesterol reports. Richard had textbook atherosclerosis, the very buildup I described earlier, sitting quietly inside a body that every standard measurement had called healthy. He survived, but the cardiologist who treated him told him something that has stayed with me ever since. He said Richard's labs were never lying to him. They were simply never designed to catch what was actually happening inside his arteries. Richard's story is not rare. It is common enough that most physicians who treat patients over 50 have their own version of it. I share it with you not to frighten you, but because I want you to understand something clearly. Feeling fine, running 3 miles, and having good cholesterol numbers did not protect Richard, because none of those things were measuring the actual danger building inside him. The tools that would have caught it, the coronary calcium score and the inflammation markers I mentioned earlier, were never part of his standard checkup. That is not Richard's failure. That is a gap in how most routine care is structured. Richard made a full recovery, and today he still rakes his own leaves every October. But he also gets a calcium score follow-up scan every few years now, and he asks his doctor for inflammation testing at every annual visit. He told me once that the hardest part was not the recovery. It was realizing that being careful with his health for 30 years had given him real confidence, and that confidence was not entirely wrong, it was simply incomplete. I want to say something plainly because I think it deserves to be said without softening it. The reason most people never get a coronary calcium score or an inflammation panel is not because those tests do not exist or do not work. It is because the current system is built to treat illness after it appears, not to search for it before it does damage. There is no billing code that rewards a doctor for spending extra time explaining small, dense LDL particles to a patient who feels completely fine. A 15-minute annual physical is simply not built for that kind of conversation. Prevention does not generate a follow-up appointment the way a heart attack does. I am not saying this to blame any individual doctor, because most of us went into medicine wanting exactly the opposite of this outcome. This pattern is not limited to any single clinic or any single insurance plan. It shows up across the entire system because the incentives guiding routine care were built around responding to illness, not around hunting for it years in advance. I am saying it because you deserve to understand why you may have never heard the word atherosclerosis from your own physician, even though it is one of the most common and most measurable conditions in people over 50. Once you understand that gap, you can start asking for the specific tests that actually close it, instead of assuming your annual checkup is already covering everything it should. Here is what I want you to take from Richard's story and from everything we have covered so far. A heart attack rarely announces itself in advance. It builds silently, year after year, inside people who are doing many things right, which is exactly why it catches so many families completely off guard. I have watched adult children sit in a hospital waiting room in disbelief, saying their mother or their father was the healthiest person they knew. That disbelief is real, and it is also preventable, more often than most people realize. This is not about living in fear of your own heart. It is about refusing to let silence stand in for safety, the same silence that nearly cost Richard everything on an ordinary Tuesday morning. Most of the families I have sat with after a heart attack say the same thing afterward, that they wish someone had told them sooner exactly what to ask for. Consider this video that conversation, arriving before the emergency instead of after it. If this video has changed even slightly how you think about your own heart, please take 15 seconds right now and share it with someone you love. Send it to your spouse, your sibling, your adult child, anyone whose habits remind you even a little of Richard's. This is not the kind of information that should stay locked inside one video. It is the kind of information that saves a Tuesday morning exactly like his. And if you have not yet subscribed to this channel, this is the moment to do it. Every video like this one exists because people just like you decided this information mattered enough to keep showing up for it. Subscribing does not cost you anything, and it means the next warning, the next test to ask for, the next habit to change, reaches you before it becomes an emergency instead of after. Before we move into exactly what to do about everything we just covered, I want to ask you a quick question, and I promise there is a real reason behind it. How old are you right now? Type your age in the comments below. I ask this on every video, not out of curiosity, but because heart risk, ideal blood pressure targets, and even how aggressively to pursue testing like a calcium score genuinely shift depending on your age and your specific stage of life. Knowing who is actually watching helps me shape exactly what I record next, so that the advice I give reaches the people who need that particular version of it, not a generic answer meant for everyone at once. Let me ask you something that might sting a little. If your heart could send you a text message every time a small patch of plaque formed inside one of your arteries, how many messages do you think you would have received by now, this year alone? Most people assume the answer is 0, or close to it. The honest answer, for most adults over 50 in this country, is likely dozens, and every single one of those messages would have gone completely unread, because the body does not send warnings that way. Silence is not the same thing as safety. It never was. That single idea is worth sitting with for a moment, because it changes the entire question you should be asking your doctor. Instead of asking, "Do I feel okay?" the better question becomes, "What is actually happening inside my arteries right now, whether I feel it or not?" Now let me finally answer the question I opened this video with. The one number that matters more than your weight, more than your total cholesterol, and more than how many miles you can run. That number is your coronary artery calcium score. It comes from a quick, low-dose imaging scan that looks directly inside your arteries and counts actual calcified plaque, giving you an actual score, often somewhere between 0 and several hundred, rather than an estimate built from indirect blood markers. A score near 0 means very little calcified plaque has built up so far. A higher score tells you and your doctor exactly how aggressively to act, often years before any symptom would ever appear on its own. I told you earlier I would come back to why a completely normal cholesterol test can exist in a body that is quietly building dangerous plaque, and now you have the full answer. Cholesterol testing estimates risk indirectly. A calcium score measures the actual physical evidence directly. They are simply not the same category of information, and Richard's case is proof of exactly how far apart they can be. And remember that resting heart rate you calculated earlier with your fingers on your neck. For most healthy adults, a resting heart rate consistently sitting between 60 and 100 beats per minute is considered within normal range, though closer to 60 tends to reflect a heart that is working efficiently. If your number came in well above that range consistently, it is worth mentioning to your doctor alongside a request for calcium score testing, because a heart working harder than it should, even at rest, is often another quiet signal worth investigating rather than ignoring. I would love to hear from you directly in the comments. Have you or someone in your family ever experienced a health scare that came out of nowhere the way Richard's did? Sharing your story does more than you might realize, because someone else reading it may recognize their own life in yours, and that recognition is sometimes what finally pushes a person to book the test they have been putting off. And while you are there, tell me what you want me to cover next. Blood pressure, blood sugar, joint pain, sleep, memory, whatever is genuinely on your mind. These videos exist because of exactly these comments, and I read every single one of them. I want to warn you about something honestly, because I have seen it happen to so many patients. Once you start walking daily, cutting back on processed food, and sleeping better, you will likely start feeling noticeably better within just a few weeks. Your energy improves, your clothes fit differently, people start telling you that you look great. And right at that exact moment, something strange tends to happen. That improvement becomes the reason people quietly stop pursuing the deeper testing, the calcium score, the inflammation markers, the follow-up conversation with their doctor. Feeling better gets mistaken for being fixed. I need you to hear this clearly. Feeling better is real progress, and it matters. But feeling better happens on a completely different timeline than clearing calcified plaque that may have taken 15 or 20 years to build. That plaque does not disappear in 6 weeks just because your energy has improved. The moment you start feeling good again is not the finish line. It is actually the real test, because it is the exact moment most people let their guard down and stop asking the harder questions. The patients I have watched do the best long-term are the ones who kept pursuing the actual testing even after they started feeling great, precisely because feeling great and having a clear coronary artery are not automatically the same outcome. I have seen patients stop their walking routine the moment their energy improved, thinking the hard part was over, only to return to my office 2 years later with a calcium score that had climbed higher than it should have. Do not let feeling good talk you out of confirming that you actually are good. So let me bring all of this together into a clear plan you can actually act on this week. None of these 8 steps require expensive equipment or a complicated program. They require you to ask for the right information and then act on what you learn. The first step is to ask your doctor directly for a coronary artery calcium score, not just a standard cholesterol panel. Say those exact words at your next appointment, because many doctors will not order it unless you specifically request it. The second step is to ask about inflammation testing, specifically a marker called C-reactive protein, and if your doctor is open to it, a marker called lipoprotein a, which is a genetic risk factor most people have never been tested for even once in their life. The third step is to move your body every single day, even if that movement is nothing more than a 20-minute walk after dinner. Consistency matters far more than intensity when it comes to protecting the inner lining of your arteries. The fourth step is to take a hard look at ultra-processed food and added sugar in your daily meals. You do not need a perfect diet. You need fewer of the foods that keep your blood sugar spiking throughout the day, since those spikes are part of what damages your arteries from the inside. The fifth step is to check your blood pressure at home, not only during the rushed few minutes of a doctor's appointment. A simple home monitor, checked a few times a week at rest, often reveals a far more accurate picture than a single reading taken while you are anxious in a waiting room. The sixth step is to protect 7 to 8 hours of real, uninterrupted sleep most nights. If you struggle with sleep, mention it to your doctor directly, because poor sleep is not a small lifestyle detail. It is an active driver of the inflammation we discussed earlier. The seventh step involves supplements some of you may already be considering, like fish oil or Coenzyme Q10. Talk to your doctor before starting either of these, especially if you take blood thinners or blood pressure medication, since both can interact with common prescriptions in ways that matter. And the eighth step is to manage stress in a real, sustainable way, whether that is prayer, time in nature, time with grandchildren, or simply 10 quiet minutes with your own thoughts each morning. Chronic stress is not a soft, secondary factor in heart health. It is one of the central drivers of everything we discussed in this video. You do not need to do all 8 steps perfectly starting today. Pick the first 2 that feel most doable this week and build from there. Momentum matters more than perfection. Thank you for spending this time with me today. I know there is a lot of noise out there telling you what to eat, what to buy, and what to fear, and I try very hard to make this channel something different, a place where you get the straightforward truth instead. If today's video gave you even one thing to bring up at your next doctor's visit, that is exactly why I make these. If you are not subscribed yet, please consider joining this community. It genuinely helps more people like you and like Richard get this information before their own Tuesday morning arrives. One last thing before you go, and I say this because I genuinely care about you, not because I am required to. Everything in this video is meant to help you have a smarter, more informed conversation with your own doctor, not to replace one. I do not know your personal medical history, your current medications, or your specific risk factors, and I could never responsibly guess at those things through a video. Please talk to your own physician before starting any new supplement, before making major changes to your exercise routine, and before requesting any of the testing we discussed today. You deserve care that is built around you specifically, and I hope this conversation helps you ask for exactly that.